My father grabbed my wrist and he threw me onto the table. The first person to me was my father. I didn't really understand what had happened, but I knew it was wrong.
Ugh, I'm gonna cry. My name is Dr. Kirk Honda. I'm a therapist and a professor and a podcaster and YouTuber.
The day of the attack, it was my 28th birthday, and I wanted to actually have a good time because I'd been so unhappy for so long. I was getting drinks and he was across the street. He followed me. I was at the corner because I was waiting for the light and he came up to me. I just remember he was yelling and screaming, and then I was out because he had knocked me out. How does somebody that you've loved, that I've had his child, just knock you out and leave you on the side of the street? I lied down, I think, for 3 or 4 hours because it was really late. And then he was in the kitchen when I woke up, and I went and I looked at myself, and I had black eyes. My face was swollen. It looked pretty bad. And I saw him in the kitchen, and he came up to me. He's like, "What happened?" I'm like, "Really? You're going to say that?" He goes, "Oh my God, I'm so sorry." And I'm like, you know what? I don't even know what to say to you. And then that day, the pain in my face was so severe. I went to the emergency room and they told me, "Oh, well, it's okay, fine. Here's some antibiotics and pain pills. Go home." So I did. But the next day, my face started swelling more and more until I couldn't breathe. And he had given me the wrong antibiotic. And that's one of the reasons why the infection was so strong in my face it was turning black. It was going to go down my throat to my heart or up my head. So it was going to kill me. The ambulance had to take me to USC County Hospital. And they have doctors and residents that want, to work on patients that are really difficult. They put me into surgery right away, and they just started cutting everything. The first time my kids came to see me, my oldest daughter, she is so resilient. And I was not a great mother to her because I had her at 19. I had no examples of a really good mom. She knew me before this, so she was just crying because she didn't know what happened to my face. And then my little boy, he was like 2 or 3, and he just refused to talk, and he wouldn't come near me. He would scream and yell for 6 months. He wouldn't come near me. He recognized my voice, but he didn't recognize me, and I was pretty scary looking, so he wouldn't come near me. I had no face. I never went to a therapist. I never went to a counselor. I never dealt with my issues from when I was younger. It was really difficult. So I actually went back to doing because I didn't know what else to do. That's the only thing that I knew would make me feel better.
Sandra is a very resilient person. I remember thinking that when I first saw this video. First thing she talked about was being assaulted by her partner. And her question is, how can you do this to me? I'm the mother of your kids. And that's a question that a lot of intimate partner violence victims will ask. The way that she put it illuminates something that is often ignored or denied. Sandra is illuminating something that often isn't talked about, which is that for perpetrators of intimate partner violence, they often will be characterized as very clingy, which is an adjective we typically will use for individuals who are desperate or afraid of losing their partners or insecure. Online, people will characterize it as a narcissistic trait, but I have treated perpetrators of intimate partner violence who, the vast majority of them, were not psychopathic, were not narcissistic, and in fact had tremendous abandonment trauma growing up. And when you're desperate, as we all are, for closeness, particularly if you've never had it growing up, it can result in this. I'm not saying that it's okay, of course, what they're doing. She's talking about how she suffered from addiction as well, substance abuse. She was talking about how she suffered an assault. And then she talks about how, I think she's saying that she was mistreated by the medical system and not given enough care.
I tried to get my family to find my children, to find him so that I knew where my children were. I was, pretty concerned for them. After I left the hospital, I was wearing a surgical mask and sunglasses and a scarf to hide myself. I was in a women's home, so I did have help. Like I said, I was wearing this mask and the glasses. I wore that for 12 years. I'm not going to wear the mask. If you don't like me, if you don't want to look at me, I'm not going to feel like that's my problem anymore. Well, the reason that I share my story is because I hope that it will impact someone. If it helps one other person, it was worth me going through all of these stages and steps to say how difficult it was. I would tell anybody that is in a domestic violence situation right now that it doesn't get better. I have never met one person that has said, you know what, he got better, everything's good, we're just lovey-dovey. And if you are the abuser, well, it's definitely an anger issue. Sometimes you don't even have the will to stop.
One of the reasons why it's jarring to me is because society will not show us these images, these people, because of stigma, and these people won't show up on camera. As she said, for a long time, she would hide her face. It sounds like she's recovered. The journey to recovery and abstinence is complicated and unique to every individual and involves a lot of elements. Often trauma recovery is important as well, to have concurrent with one's recovery from substance abuse. So I'm guessing that she went through a lot and had a lot of ups and downs, but sounds like she's recovered and she's telling her story, which is a wonderful story. Typically, people aren't ready to move or even accept that they're in an abusive relationship. It can involve a lot of elements that are shifting their perspective and their self-worth, such that just telling them to leave is not likely to work. Might even alienate them from you, particularly if they feel judged by you, such that they don't come to therapy anymore and might not even go to any therapist anymore. So you have to be very careful about that. Best case scenario, the individual, the victim, wants to leave themselves or wants to go down a road where they eventually leave. It's complicated because perpetrators can ramp up their abuse if the victim starts to feel their feelings and express. So there's a strategy to allowing the self to have the feelings without incurring the consequences. You know, it can be complicated. If someone were to come to me and tell me I'm in an abusive relationship, one of the first thoughts I would have would be this assumption that they might not leave for months, if not years. I feel like that message needs to be out there because some victims won't reach out, because when they do, whether it's a clinician or not, they will get an immediate pressure or judgment like, well, you got to leave. Way more complicated than that.
I'm born and raised in the United Kingdom, a few hours away from London. My heritage is Indian. By the age of 6, I was only allowed to come out of my room when I was called upon to cook or clean. I wasn't allowed to sit with the family. I had no verbal communication with anybody. And I remember feeling quite groggy and sleepy one night, and I was woken by my mother. I understood I had to cook. I prepared the food, and my job was then to stay and wait until they'd finished. And then I heard the call, and I knew I shouldn't go in, but I feel no choice. And as I walked in with my eyes down, my father grabbed my wrist and he threw me onto the table. The first person was my father, and it led to a very long ordeal, which was very violent. And they me continuously. When I did eventually wake up, because I'd passed out, there were cuts and bruises all over my body. I didn't really understand what had happened, but I knew it was wrong.
I'm going to cry. As a therapist, I've heard stories like this. It's one thing to have abusive parents, to experience intimate partner violence between your parents, and then to learn those wrong lessons and to go through abandonment yourself, and then you're trying to eke out your own attachments and closeness and sanity as an adult, and you start to abuse substances, and then your partner seems to be distant and not wanting to be with you. Maybe you're making that up in your head, maybe you're not, and you strike out violently. What would be going through your mind to do any of these things to a child? This is not abandonment trauma. This is sadistic, psychopathic behavior. I worked with some of these individuals, and I learned that there are people that are hell-bent on harming other human beings. That's what they literally wake up in the morning and think, how can I harm people and get away with it? And children are easy targets because they're under, full control of these individuals. When we're born, we seem to have an instinct to run to our caregivers. Once we identify, which is around 5 to 7 months, who our caregivers are, we will run to them when we are scared. The problem is that if the home base is also the horror, they are the monster, then the child glitches. They don't know what to do. They have a tremendous urge to run away from the monster and a tremendous urge to run toward the home base. What can happen later in life, if this is not treated, the individual as an adult will obviously be desperate for closeness and safety and security in friendships and intimate relationships. And as they approach and get closer to people who are safe enough to start to attach to, they will have an increase in terror.
I asked my mother, could I shower? She said yes. My mother wouldn't let me use the shower, but she would let me use a bucket, and I filled the bucket up with water and washed that way. She told me to clean the floor. I went into the room and managed to get my blood out of the carpet. So I was pregnant from the night of the and having told my mother that my periods had stopped. She called my father. When he came, he was really cross. He was really angry. And he said that I had ruined his life. I had brought shame upon the family. That now he was going to have to sort this problem out. I ended up at a clinic. I remember lying down on like a stretcher type of bed. I remember having gas and air. The next thing I knew, I'm in a gown. I just turned 15 when all of this was happening. I remember driving back from the clinic, and my father and mother were both saying the same thing, that she would have been better off dying when she was born. I was led into the guest room, which is the same room in which I was raped. I heard a voice of one of the men that had raped me, and with him was his wife, and they said that we're going to do the engagement now. And I understand I'm going to marry the son of the person that me. So I'm marrying the son in a sham wedding so that when I'm married, I can be a servant and a domestic servant for the man that me. I was there for 4 years. Every day I pulled out my father-in-law's hands out of my underwear, pushed him off me. He sexually abused me. The mistake they made was they were greedy for money. So they asked me to find a job. And it was the first time I was exposed to the real world, really. I would walk to work and I found this amazing job, and I created a different persona because I needed to earn to please my mother and father-in-law. So I started to tell one of the girls, because she was from the same culture as me. She said to me, go back home. Just don't go to your in-laws. People say, but why would you go home if that's where you were raped and treated so badly from birth? But when you have nobody else, you go back to the place that you know. I stood at the door and knocked on it, and my father opened the door. He grabbed my hair, literally forced me into the house, but it was the words he was using. My mother failed him by birthing a girl.
She's talking about going back to her abusers, and that's an important aspect of being a victim, particularly when you're a victim since birth. Once people have extracted themselves, that they'll self-sabotage because psychologically they think, well, I might as well get out ahead of this and cause it so that it doesn't happen out of the blue. At least I can be in control of my life going down the tubes, or bad things happening to me, or being around people that exploit me, because it's going to happen, because it's always happened and it always will happen. To repair that sense of the self and sense of your worth, it takes years and years of reparative work where the individual is given a chance to really absorb that they are worth something and that they're not flawed on the inside. In fact, they're quite resilient and strong. I'm guessing that she has been down that road, given that she's talking the way that she's talking. I'm guessing she has a long way to go, given how severe this is.
My eldest brother was there, and they both started to beat me. They were trying to kill me, and they kept using the word honor killing, that they had to maintain the respect. And I do believe at that point I left my body completely because the pain stopped. My mother's friend, she opened the door and said, they're sending you to India on Sunday. I had no idea what day it was. I started to talk to myself. It's the only thing I could do. And I asked myself the serious question, do you want to live, or are you ready just to give up? And I don't know why, but I wanted to live. It was my mind that got me to move, and I would try and pick myself up on my hands and knees, and I couldn't do it. So I was using this part of my arms to bring myself up and shuffle forward. I got to the door. Then I had the problem of reaching the handle, and I remember trying to reach, but this arm was broken. But somehow I got out, and I made it to a taxi rank. And that's where I got some help. One of the drivers turned up, "Is somebody after you?" And I said, "Yes." I ended up being in hospital for 2 months. And I really believed I'd changed the cycles of abuse because I celebrated her not understanding the situation I was in with my new partner now. And time went on. The abuse got worse. He would sometimes strangle me to a point where I was sure I was going to die. He said my children would hate me in the end. This carried on. My daughter went to university. She noticed things were wrong. She started to question him and said, "Don't treat mummy that way." So his solution to that was to cut me off and not let her have any interaction with us. The sensible thing would be to leave. I had no common sense. And it was my son that was brave enough to say at school, "I need help. I can't take this anymore." I've moved away over 400 miles from the area I was born in. And that was probably the best thing that happened in my life, for not just myself, but my whole family, my children. Tomorrow doesn't exist. You've only got today, and you deserve it. You deserve to get out of that situation today, and things will get better. I was homeless 6 years ago, and I'm here now living my life happily with gratitude with my 3 amazing children.
I can't imagine even 1% of what she's been through. It's amazing to see the strength in her. We aren't born understanding emotions. We have to be taught. In an ideal situation, parents are reflecting the emotions to children, which I would say that even in non-abusive families is typically suboptimal because of our society. In all likelihood, if you're being abused, you're also not being helped with understanding and regulating your emotions. When you are an adult and you are being abused, the main way we can notice that we're being harmed, if we've cut ourselves off from our emotions, and the little bit of emotions that manage to sneak through, we don't even know how to interpret, then we are going to have a hard time noticing that we have recreated a situation that is unfair to us and that we deserve better.
My biological mom at 7 months old, she took me to my paternal grandparents' house, dropped me off, and said, "Deal with her." When I was 6 years old, my dad got married to a woman who had a son of her own. And at that point in my life, I was really close with my dad. I was daddy's little girl. And then when he got married, I wanted to go live with him. And so that's where I went. It didn't take very long for me to realize that that was probably the worst decision I could have made. I lived with my dad, my stepmom, and my stepbrother for about 18 months. And during that time, I was abused in all of the ways, physically, emotionally. I was only allowed to eat what my stepmom put on my plate, and I wasn't allowed to have seconds. I lived in a bedroom in the basement, unfinished basement. Whenever my dad wasn't around, my stepmom would take it upon her to beat on me. I can remember there was one chair in the living room that I was allowed to sit on, and it just so happened to be placed in the room in a way that my stepmom had to walk past that chair to get from her bedroom to the bathroom. And so on her way by, let's just smack Emily. It didn't matter at mealtime if I was still hungry after I ate all my supper or all my lunch. I wasn't allowed to have more. My stepbrother found magazines and somewhere in his mind thought it was okay to force me to remove my clothes and use his fingers to take my virginity. I do believe that my stepbrother said that if I said anything, he would beat me. And in the instances where he was harming me and violating my personal space, I was super attentive to how he would behave. So I could tell before anything happened what I needed to do to distract him. I was scared. I thought that it was my fault. That's what I believed. And so I didn't say anything. My dad walked in on my stepbrother hurting me, and he got really mad, and that's where it ended. And then one Sunday evening in November of 1997, wasn't too far off of Christmas. I was at my mom's house, and she told me to go get my bag ready. And I had come to the conclusion that if anyone was going to save me, it was going to be me. So I went in my sister's room, and I had decided that I was not going back. So I packed up my things, got all my things in my bag. So I was so small, so scrawny, that I was able to fit under my sister's desk. And so I fit in the chair hole, and I managed to get my overnight bag wedged in the chair hole so that nobody could see me. And I sat there crouched up. I don't know, it might have been an hour. To my 7-year-old self, it was forever. And my sister came in looking for me, couldn't find me. My brother came in looking for me, calling my name. Nobody could find me. A while into this, my mom noticed my overnight bag. So she moved it and found little Emily. And what's going on? I'm not going home. Oh, okay. What am I supposed to do? Now I'm thinking, okay, you're the adult. And so she got on the phone. She called my dad and he called my grandmother. And what I'm told the conversation is, Mom, Em won't come home. What am I supposed to do? And my grandmother said, bring her here. So that night I went back to live with my paternal grandparents until I was in my mid-20s. I found a naturopath who sat and listened to me, which is the first time a healthcare provider ever listened to my whole story, and explained to me how the stress that I was living in as a little girl that I had been storing up through my teens and my early 20s was impacting my entire body. Like, I dealt with infertility for the first year and a bit of trying to conceive. When I was in my teens, I made the decision that I didn't want to be a mother because I didn't want to repeat the cycle that I had lived. If I only help one woman, then it's worth sharing my story. That's how I'm helping the kids like me, is through sharing my story and empowering them.
We cope with the being pushed into a corner without any way out. We don't have any knowledge about how to get out, how to cope, how to move forward. When it comes to parenting, we see stuff and there's talk about stuff about how to get a kid to sleep or how to get a kid to eat their broccoli or whatever. There's talk. There's TV shows. There isn't talk or TV shows about this sort of thing. And so people don't know what to do. The individual wants to belong, wants connection, wants close relationships, wants to be understood, wants to be a part of a collective of some sort. And they're being thwarted. They're being rejected. We are social creatures. We are not individual creatures. When we're going through something horrible and it's hopeless, but we feel togetherness, we're with people, they understand us, maybe going through the same thing, then we don't think about suicide typically. It's heartbreaking to hear her, Emily, talk about that. I don't blame people for having those feelings. I blame society and the education system to some extent.